before I go any further, I wanted to try to keep this as interactive as possible. And what I would request is that if you are joining from your laptop, please just take out your mobile phone, scan this QR code, and you can vote there, or you can actually vote on Zoom itself. And I shared that poll. Let's just try and get an understanding of, I hope none of you have experienced this in the past, but if you have, what do you think should be the first thing that you should do? You're at a party, somebody collapses. What is the first thing that you should do? Let's just, we'll give people some time to vote on this. Zoom is obviously a lot easier. So right now, calling for emergency help is leading, at least on Zoom. 65% of you want to call for emergency help. The remaining 30% or so want to start chest compressions. Okay, so some of you don't know as well. Okay, so I think this is, point number one that I wanted to drive home across. The majority generally tends to be right. And, the correct answer for this question is actually call for emergency help. There are American Heart Association guidelines. There are guidelines by the Oxford Medical Association unit as well for medical emergencies. And all of them highlight exactly this point, that when you are faced with a medical emergency, you call for emergency help. That is the first thing that you do. That is take home message one. I want all of you to remember this. I'll obviously refer to this in subsequent sections in the slides as well. But how would you actually call for emergency help? So, in the US, obviously we have 911. UK has their own centralized medical emergency helpline. They have a corroborative helpline as well. In India, how would you call for emergency help? Would you call a nearby hospital? Would you call, a doctor that you know? Would you Google for ambulances? What would you do? Okay, so most of you would call the national and state helplines, or call a nearby hospital. I'm hoping you at least remember the number of those helplines. Might be a decent idea to start putting it in the chat as well, for people who don't know. Okay, so this, I think, is the second message that I wanted to sort of highlight. And that before we go deeper into the actual training part, today, we have 20 times the US mortality rates when it comes to medical emergencies. So I'm not trying to create fear in anybody's mind. I'm just trying to create awareness around this issue. That today in medical emergency management, we are really struggling. When it comes to specialist medical care, we have the best hospitals, we have the best doctors, our infection rates are lower, our mortality rates are lower. But when it comes to managing medical emergencies, we are not even in the same ballpark. We are way behind. And one of the key things is, obviously there are a bunch of problems that you can see on your screen, but one of the key issues is that people simply don't know whom to call. So the dispatch, people don't get access to quick, credible medical attention when they need it the most. We don't know whom to call, which has obviously been highlighted by the poll. It's a fairly split poll. And none of our national or state helplines, 0%, none of them have a doctor on call. So all that these helplines do is connect you to an ambulance, and which will take its own sweet time to arrive. So that, I think, is one of the probably the most important things. If there's one message that you take home from this webinar, I think is this, that all of us should have an emergency contact in place. And I'll just highlight, what this results in a country like ours. So same example, somebody in the family complains of chest pain, right? What happens next? There's chaos, there's panic, there's confusion. You don't know whom to call. You don't know which number to call. You finally manage to dig out some number, either helpline or hospital or doctor, whatever. Help takes its own time to arrive. Half of our ambulances don't even reach in the first hour, which is the golden hour, let alone the recommended 10 minutes. And most importantly, people don't know what to do until an ambulance arrives. What do you do till then? What do you do in those 15, 20, 30 minutes? And when it does arrive, equipment is missing, paramedics are missing. And, by the time you get to a hospital, in many cases, it's a little too late. So, whenever we've spoken about this issue, people agree that this is a massive problem. People agree that this needs to be solved. But somehow, there is an underlying belief that this might not really apply to me. As in, it's, it might apply to the rest of the country. I will be protected. I have, things in place. I have connections in place. We don't. I think this statistic just highlights how widespread the problem actually is. This is from the Niti Aayog report last year. And this is a problem that affects all of us uniformly: young, old, rich, poor, metro, non metros. It does not matter. We do not have a centralized emergency response. And that's the main problem that we as an organization are also trying to change. So we are a team of three co-founders. Vedant, I'll start from the right of the screen. Vedant is from St. Xavier's, followed by an MBA from IIM Lucknow. He handles operations for us. Shubham is BTech, MTech from IIT KGP, handles tech for us. I obviously handle everything that they don't want to handle. And after having spent more than 10,000 hours in emergency rooms, both in India and in the UK, just realized the need for this particular, for this segment to be actually solved for. So, all of that data awareness / fear aside, I hope I, have your attention. I promise to keep this relatively short and as concise as possible. But what I've tried to do is that let's just look at the 5 most common medical emergencies that, some of us might have to face in our lives. And what are the 3 things that we should keep in mind while we are facing this? So just wanted to highlight this up top, that CPR training itself, somebody had asked about certification of these are all specific webinars that cannot be covered in 30 to 45 minutes. These are very, very specific topics that require dedicated effort. So this is not going to be a training session, definitely not going to be a hands-on training session, but I wanted this to be more, the 3 or 5 most important things that you should be aware of if and when you're faced with some of these issues. So to start with, heart attack and cardiac arrest. I don't know if all of you are aware that there's actually a difference between the two. They are not the same. So a heart attack and cardiac arrest are 2 very different things. And, maybe if somebody knows, happy to, so you can definitely post it in the chat and let's see if you're right. But essentially the difference between the two is that, let's start with the heart attack. So heart is an organ that basically pumps blood to the rest of the body. The heart itself has certain blood vessels that are responsible for providing the heart blood. And when these blood vessels, which are called the coronary vessels, once they get blocked, that is what you experience as a heart attack. So obviously, we've seen movies around this. The common symptoms of a heart attack would be chest pain. It might go down the left arm. There might be sweating, palpitations, panic attacks, sometimes lightheadedness. These are general symptoms of a heart attack. And obviously, in some cases, it might be a silent heart attack as well. Heart attack, the technical term for a heart attack is something which is known as myocardial infarction, or an MI, as some of you might be aware. This is something that a lot of us are actually aware about. What a lot of us are not aware about is something which is called as a cardiac arrest. Now, a cardiac arrest essentially means that the heart, which had the sole purpose of pumping blood to the rest of the body, has stopped functioning. Cardiac meaning heart, arrest meaning stop. So the heart has stopped. It's an electrical problem. And as you can imagine, now what happens if the heart stops pumping blood? Your brain doesn't get blood, your lungs don't get blood, your liver, other organs don't get blood. So a cardiac arrest is a very, very, very serious issue. And a heart attack, although is fairly significant, it is not as significant. So this is something that I think is important for us to differentiate. And what does this translate into day-to-day life? So, obviously medical lecture aside, how does this translate into real life scenario? So if you have a patient who's had a cardiac arrest, unfortunately, what will that patient present with? They will essentially be unconscious because there's no blood going to their brain. So they'll be unconscious. And because the heart itself is not pumping again and again, they will not have a pulse. So point number 1 on the screen is that everyone should recognize this and activate an emergency response system. If and when you are faced with a scenario where somebody is unconscious and they don't have a pulse, or you cannot feel for a pulse, or you don't know, either which way, activate an emergency response system. It could be anything. It could be a hospital, it could be an ambulance, it could be a doctor, it could be guardians, it could be anything, but please activate this response system. And the reason why I keep repeating this point again and again is that this is probably the only thing that everyone can do. And this is something that everyone should do. Because the next few steps, which is CPR, which is cardiopulmonary resuscitation, which includes the chest compressions and the rescue breaths, is something that requires some degree of training for. And in the US, I think Aisha mentioned that in the US and the UK, this is part of mandatory school and college curriculum. India, it is not. And most of us, at least on the webinar, I don't think are aware of exactly how to do CPR. And obviously, we are running at Guardians workshops around workplace safety and training in CPR. But this might not be applicable to everyone, which is why it's marked in orange. And then finally, in some places, you might have seen these devices which are called as automated external defibrillators, AEDs, essentially shock machines. So if you remember, in a cardiac arrest, what happens? The heart stops functioning. It's an electrical problem. What do you do in an electrical problem? When your car battery dies down, you shock it, right? That's exactly the same thing that you do in a cardiac arrest as well. And again, ideally, they should be everywhere, at least in all public places. But again, these are points number 2 and 3 are more systemic, more widespread changes that might not happen tomorrow. But at least point number 1 is something that I want all of you to be able to do. Hopefully, at least the 116, 115 people that we have on the webinar today, hopefully we are able to save a life. Okay, so now coming to trauma. So what does a trauma mean, right? So it could be something as insignificant as a sprain. You're playing, your kid was playing, you had a fall. It could be something slightly more significant when it comes to a soft tissue injury, some ligamentous torn, or it could be a small fracture, hand fracture, for example, a foot fracture, or it could be a major long bone, a large fracture, maybe a spinal fracture. In all of these cases, point number 1 remains the same, right? Recognition and activation of emergency response. But what I want to highlight is actually not that point, but is something just below that, which is scene safety. And what do I mean by that? So, in all my time in orthopedic emergency rooms, what we've noticed is that there was a child who had some fall or injury in the bathroom. Some parent had an injury or fall in the bathroom, and in order, while we were rushing to help our family and our loved ones, we weren't aware about scene safety. And most of these cases, because we are ourselves rushing, we present these patients are actually not patients. They were going to help their loved ones, and they actually landed up with more significant trauma. And if you've traveled, you would have seen in the airline, they tell you exactly the same thing, right? That first put your mask on yourself and then help others around you. That's exactly the same thing. It's very simple for me to sit, on this side of the table and lecture people about it. I myself, have to remind myself constantly whenever I'm faced with all of this, is that please ensure safety for yourself first. It's a very, very important thing. The second point is vitals monitoring. Now, again, it's a very common situation when somebody's had a trauma or a fracture. Obviously, in slightly relatively insignificant fractures, you don't need to monitor vitals, right? Somebody's had an ankle sprain, you don't need to monitor their pulse or blood pressure. But let's say you have an elderly parent or a grandparent at home and they've fallen in the bathroom, they fractured their hip. It's a fairly common scenario. Please try and ensure that you have a BP apparatus at home. Even if you don't have a BP apparatus, just take their pulse, see if they have, their vitals are maintained, they're breathing normally. This is again something that everyone can do and everyone should do. Before we actually start focusing on the limb, let's go back and focus on the person. And finally, this is one acronym that again everyone can do, which is called as the RICE acronym, which stands for rest, ice, compress, and elevate. For all relatively insignificant traumas, which are not life-threatening traumas, this is a protocol that is universally applicable. What do you mean by rest? Rest basically means that whatever position you have found the person in, just make that person comfortable in that particular position, which means that in this example that you see on your screen, they have injured their knee. Just put a small towel under their knee, make them comfortable. Do not move the limb. Do not try to make the person stand. Do not try to make them walk. Just rest in that position that you found them in. Very simple to do. Second is ice. So you can either apply ice directly, or you can apply a cold pack, or you can wrap some ice in a small towel, apply it there, apply ice locally. Patients can do it themselves, or you can do it for them. Again, very simple to do. And this should be done, ideally speaking, at least in the first 1 to 2 hours, 3 to 4 times an hour, which means that you're doing this for about 5 minutes. The ice melts away by then. Wait for about 5 minutes, restart 5 to 10 minutes, and restart again. Compress is something that ideally should be done. But in an Indian context, what we've found generally is that patients are not really aware of how exactly to do this. And what we realize that in some cases, they actually might be doing a little more harm than good. So for compress specifically, my suggestion for most people would be that if you are not trained in this, if you're not aware about this, like most of you might not be, please don't try to do this. Wait for medical help. Elevation is something that all of you can again do. What does elevation mean? So if you see on the image, they have two pillows, right? One below the head is to prop up the head a little bit. The second is to prop up the limb, the foot, the leg, which is injured. And that's on an average about 5 inches above the heart. That's a standard policy. Even if you are not, you cannot measure these inches properly, just slightly above the level of the heart is good enough. This is to ensure that the swelling that appears in that particular limb is as minimal as possible. So, this is basically something. Now, if you look at trauma, you see everything is in green. So, hopefully by, after you go back today, in case, I hope you're not, but in case somebody experiences or somebody in the family experiences trauma, all these 3 steps are something that you can do yourself. Point number 1, we've already discussed, scene safety. Please remember that. Vitals monitoring, again, all of us today, especially post-COVID, we have a BP apparatus and a pulse ox at home, most of the homes that, are there today. And then rice, we've discussed as well. So for a trauma management, I think this is good enough. Now, 2 or 3 specific examples that I want to highlight here before we move forward is that there are some times where people have spinal trauma, where they fall and they injure their spine, either their neck, which is the cervical spine, or the upper or the lower back. In these instances, please just remember one thing: please do not move the patient. That is the only thing that you can do. Beyond that is specialist emergency care. That is not for everyone. But just one thing that I want everyone to remember is that please do not move the patient. Let them stay in the same position, monitor their vitals, wait for help to arrive, because the chances of nerves being damaged in movement are actually very high. Okay, so now coming to the second last point, and I hope that you're not bored, is seizures, right? So again, there are some specific causes of seizures. You might have patients at home who suffer from these disorders, but also in cases where you have either very low or very high blood sugar, even then that can cause seizures. Gastroenteritis can cause seizures. So it's not that seizures only happen in seizure disorders. They might happen to normal individuals as well in certain instances. What do you do then? So some very simple do's and don'ts. If somebody is seizing, point number 3, turn them on the side. Please turn them on the side. That's the first thing that you do. This is to prevent any vomit or any secretions, any nasal secretions from going down the windpipe and causing the person to choke. So just turn them on the side. Don't hold them down. You don't need to hold the person down. You don't need to clamp them. You don't need to tie them. Just turn them on the side and just hold them from the back. Point number 1. Second, there's a general tendency, and some of, we have been taught, not medically, but, our elders have taught us that put something in the mouth to prevent the tongue from being bitten. While that does prevent the tongue from being bitten, that again increases the chances of choking. So please do not put anything in the mouth. Cushion the head, remove the glasses, loosen tight clothing. Again, very important point. One of the most common causes of seizures in non-seizure patients is actually the fact that their tie was too tight. So tie, definitely loosen. If you have a very tight shirt or sweater on, please loosen that. and wait for the seizure to settle down. These are some of the very basic things that you can and you should be doing in cases of any patient who has a seizure disorder. And finally, now coming to burns. Uh, Point number one here is exactly the same as trauma. And I've purposely kept it like that because in cases of burns, scene safety is actually arguably a little more important. So, exactly the same step as trauma. Please ensure scene safety first for yourself, recognize and activate an emergency response. Point number two is that there are burns protocols that depend on the location of the burn, the degree of the burn, other injuries. These are proper protocols that medical professionals have to do. Please do not apply any lotions or ointments yourself. The only thing that you should be doing is that if somebody has a burn, a minor burn, let's say a burn on the hand or the foot, it's not a life threatening burn, you are aware of that, it's very, very obvious. Wash it under running water, normal water, not ice cold, not hot, normal running water. Just keep it under the tap for about 5 minutes. That is the only thing that you should do. Please do not apply any lotions, creams, ointments without this being verified by medical personnel or professional. This actually causes a lot more harm than benefit. So that's the burns and emergency care. Finally, this is something that this I think some of you might be aware of, right? So the Heimlich maneuver. Somebody is choking. What do you do? This is called the Heimlich maneuver. Very, very simple maneuver to do. It looks very difficult. It's actually not. It's very simple. So all you do is stand behind the person, clasp your hands against each other, keep your thumb. Generally, a good idea is to actually keep your thumb inside your fingers, clasp the other hand over it, and press on the stomach of the patient. So if you see the image on the slide, you see that they're actually pressing the stomach and they're pressing in and upward. So that's what you have to do. Thumb inside, hands over it, other hand over the first hand, press over the person's stomach, and then inward and upward suddenly. And you might have to do this a couple of times for this to be actually effective. But if done well, this is one of the most important life-saving maneuvers. Again, happy to demonstrate on some specific workshops, but definitely something that everyone should be aware of. So that's for choking. It's called the Heimlich maneuver. Okay, so we'll I think go to Q&A for a bit, and I'll also request everyone to please scan this QR code and join our waitlist for stuff as well. Happy to answer any questions, and I'll take them in order.
Yes. Okay. So I've dropped a poll in case everybody can answer how the session was. Would be helpful, and you can drop your questions. So Karan, personally, I had one question. So, doctor, how does it work? For some reason, we know that like applying Colgate, yeah, ketchup over your burns is a usual one. I've seen it work as well. Sometimes it doesn't blow up, or it goes away, but the impact is reduced. Is it a preferred method, or is it advisable?
No, very, very, very good question, Aisha. I think there's obviously one medical answer to this, and there's one practical answer to this. The medical answer is that we generally tend to prefer nobody applying any ointment without medical advice. But the practical answer is that if you have a small, low degree superficial burn, so many times women, especially hair dryers or stoves for men and women both, some small burns on our hands. In that instance, applying first, three things you should do. First, under running water for about 5 minutes. Second, icing. And the third, toothpaste is actually excellent. Please use the white toothpaste, because the white toothpaste is actually the color toothpaste, especially the gel based ones are not ideal. The white toothpaste actually does decrease inflammation, but it is only for superficial burns. What happens in case of a deep burn is that toothpaste actually goes to deeper layers of the skin, it goes under the dermis, and then it causes an inflammatory reaction, which actually makes things worse. So that's how I would sort of go about doing this.
Okay. The same goes for the oil or hot water. Can we put ice? Ice is, I think you mentioned.
Yes. So for all burns, running water first, ice second, and then wait for medical help to actually tell you either over the phone or you can talk to somebody about what you should do next. In case of severe significant burns, obviously, then the protocols are very vastly different.
Got it. So kids have nose bleeding suddenly. Apart from raising the head, what else can be done to stop it?
Okay, Maria, just wanted to ask you this. What do you mean raising the head? So are you saying you tilt your head back, or are you saying you put your head down? So just, and maybe let's not put her in the spot. I'll answer it for you. So, one of the common things is that some of the people have suggested that you adopt this pose where the child is looking down and you pitch their nose. Some of the other people have said that you raise your head. I think that's what Maria is saying. 3 things that you should do. First, Maria, you're absolutely right. This is not to be done. So please don't never do this, which is somebody looking down and then pitching your nose. What you should do is what Maria has mentioned, raise the head a little bit, because the nasal bleeding, I'll come to that. So the nasal bleeding is highly unlikely to actually go down the wind. So you definitely do adopt this pose. The second thing that you should do, however, is that depending on the degree of the bleed, if it is a copious bleed, what do I mean by a copious bleed? Which means that there is blood pouring down. It's not a trickle, there is blood pouring down. And this normally happens in case of a trauma. So the causes of bleeding in children are basically 2. One, somebody scratched their nose and that causes some amount of minor bleeding. The other cause is that somebody's actually got an injury, they've bumped their nose somewhere or somebody's boxed them or whatever the issue is, trauma. In cases of trauma, the bleeding chances are significantly higher, and keeping this pose, keeping the head in this pose is actually going to have a risk of the blood going down the throat and the windpipe. So we don't encourage that. In that specific instance, we recommend pinching the nose and adopting a neutral head position, which means neither this nor this. Simple. In cases of some child picking their nose and that's causing some minor bleeding, what Maria you have mentioned is absolutely correct. The other things that you can do in something like this is to ensure that the child has some nasal packing in place. Again, very simple to do. So one very practical suggestion that works for people is actually the earplugs. So if you have some earplugs at home, just insert it in the nostril, especially if you have the foam ones. They are very absorbent, can help in emergency situations. That is something, Maria, that I would recommend. Okay, the QR code is inaccessible. Okay, can Anushri, could you just share that link directly as well on the chat? I'll just go through the questions.
Yeah. Let me take up the next question. Can you let us know some precautionary medicine that we can keep at home to give it to person who get cardiac arrest or heart attack in case if ambulance is not arriving on time?
Yes. Vidya, this is a very, very good question. I'm glad you asked this question. Medicine number 1, aspirin. So chewable aspirin tablets, you might know them as Dispirin. Brand makes no difference. Chewable aspirin tablets, please keep at home, especially for for people who have hypertensive patients with high blood pressure at home. Please keep that in mind. Next, please try to, if you can, please try to keep an oxygen cylinder with a mask at home, especially if you have some high-risk patients at home. Very, very useful, very important. Third, and again, this is something that I think most people today have at home, is to have a BP apparatus, an automated BP apparatus. You just have to tie it, it'll tell you the blood pressure and the heart rate itself. Again, 100%. The fourth is something which is, if you have some cardiologist that you know, nitroglycerin sublingual. What that sublingual means is that you have nitroglycerin tablets or patches that you put under your tongue. This is something that requires some degree of training. If you have access to that training and these medicines, that is something that you should keep at home as well. And that will sort of buy you some time in cases of heart attack. So hopefully with that answers your question. Okay.
Yes. Can you give CPR to the cardiac arrest or a heart patient, or there is some training one has to go to CPR?
Ashish, 100%. So there is definitely training and certification that you have to that you have to do for CPR. At Guardians, we are involved in these certifications and training. So if you are interested either for yourself or for your organization, please do reach out on the form. Anushri, can you please make that form fillable? I think people are finding it difficult to reach out on the form. But Ashish, coming back to your question, yes, definitely you have to have training. It is something that is normally done in a course of around 2 hours, which includes about 1 hour of hands-on training on the human mannequins, on the dummies, so that you actually are aware of exactly how you're supposed to push. It's roughly 100 beats per minute, just so that you have an idea, but exactly the depth of how you're supposed to give the compressions, and what are the other details, how you're supposed to use an external defibrillator, what do you mean by rescue breaths, and Ashish, on this particular point in India especially, mouth to mouth resuscitation becomes a little bit of a cultural problem in our country, and thereby we have a concept which is non-breathing CPR or bystander CPR or non-resuscitation CPR, which solves for that problem. So please, definitely, anyone who's interested, do reach out. We're happy to train.
Karan, doctor, I also wanted to know about the stroke as well. So stroke also happens, something similar to the same, like the cardiac arrest and heart attack, right? What is the precautions in that case?
Okay, so a stroke essentially means that, a heart attack means the heart is not getting enough blood. Stroke essentially means the brain is not getting enough blood, right? So there are two types of stroke. One is when there is a massive bleed, usually occurs in patients who have hypertension. The other is an ischemic stroke. Sorry, I'm going into some medical details, but where the arteries are constricted as well. Unfortunately, in a stroke, there is not much that non-medical personnel can do. If you are, okay, what can you do? Can you recognize a stroke, right? What are the signs of a stroke? So somebody who is either having slurring of speech, sudden onset slurring of speech, or sudden onset deviation, drooping of the mouth, or the one side of the body is getting paralyzed. It's called hemiparesis, or they're not being able to walk properly, or the sudden onset of loss of memory or confusion, right? These are the common scenarios where a stroke might be there. My suggestion is, please rush this person to the hospital as fast as possible. You do not need to wait for an ambulance. You should not wait for an ambulance. All of you have vehicles of your own. Please safely and quickly get this person to a hospital. They will get a CT scan done and evaluate what has to be done after that. So 3 or 4 simple things: recognize the stroke. I've already told you the signs and symptoms. Go to the hospital fast and let them figure out the actual cause.
Got it. So I'm just going to launch another poll. You can just fill in your responses here. What type of session would you like to join in the future? So we also keep a track and we bring out the best possible ones. Yes. Also, I wanted to ask, are smartwatches reliable for BP and SpO2 levels?
No. Another very good question. I think the simple answer is no. I think there's a very so I think, let me sort of not be politically incorrect. If you are just looking to track your exercises and you're looking to track your exercise bands, so there are various zones and bands of exercises. I won't go into those details, but if you're just using smartwatches for that purpose, which is exercise tracking and exercise optimization, by all means, please go for it. But if you are using smartwatches as tools to detect medical emergencies, then no, they are nowhere close to anything which is medically accurate. But they are getting there, and hopefully we will get there in the next, couple of months, years, whatever. But yeah.
Okay. Is there any tablet which any patient can keep in mouth to delay serious heart attack or feeling of chest pain? I guess it's the one that you mentioned.
Nitroglycerin.
Yeah. I can drop the name in the chat box as well. Okay. I think this form is not visible. WhatsApp message.
Okay, I think she just posted. Aisha, could you just reshare that link, please? I think Anushri just posted it in the chat.
Yes, I just share it. I think it's the same.
Yeah,
Latest link is working. Okay.
Okay.
I've posted that in the chat. Is there any more questions? If there is any questions, please drop them.
I think Maria has one last one. Yeah, go for it, Maria. You can ask me directly. Sachin, the tablet name is nitroglycerine. I will add it in the meeting chat, but this requires a prescription. So sublingual nitroglycerine.
Okay. While eating, if someone has come, what should be done? I just hit that person from behind to breathe. Maria, if you could unmute and ask this question, I couldn't quite understand.
No, I was just saying that, if someone has a choke while eating, I just had this incident. So I didn't know what to do. I just pumped him from behind.
Surprisingly, that might not be the most correct thing to do, but it's actually not ineffective. So it's better than doing nothing. Obviously, it's far inferior to a Heimlich. But especially,
I didn't know what to do. I just okay, I'm going to hit. I hit him from behind, and he was able to breathe fast.
Yes, exactly.
I didn't know, but what is the right procedure for this? If someone gets a choke eating something, what should we do?
The Heimlich maneuver. The Heimlich maneuver that I demonstrated in the session. So you go stand behind the person, clasp your hands, press on their stomach, pull in and up.
Okay. It's going to be difficult with the strangers to do that, but yeah, I can do it.
I think hopefully someone, if you save someone's life, I think they'll probably not be a stranger for very long.
Yeah, sure. Got it.
Okay.
So Preetham, yes, what if someone has a very high difficulty in breathing while crying? What should we do? I think this happens.
Preetham, are you asking this in context of children, like infants, babies, or are you asking this in terms of adults? Because there's a difference between the two. Adults. Okay. So in adults, what happens generally is that this triggers a reflex that causes an artificial stop. So they are still breathing, just to be completely clear, they are still breathing. They're still getting oxygenated. It's just that you can't see it, because while you're crying, that oxygenation is still happening. So it's not a very serious thing, one. Second is that this looks a lot more dangerous than it actually is. And one of the best things that you can do in this situation is to actually address the panic, to address the crying and control that. Because once you do that, automatically this will come down. You don't need to, how to calm them down. I think that depends on the person. I think it's very difficult to generalize how to calm them down. But generally, these are disorders that are seen in people who have a tendency for anxiety, panic attacks. Generally, this is a scenario that is seen in such patients. Definitely speak to your concerned doctor. There is a psychosomatic element to this as well. For infants, however, this is a very different issue, which is why I asked the question. Infants are not doing this. How to reduce glycoside? I don't think that's a medical emergency, but infants are not doing this out of purpose. Infants, if this happens in infants, that's actually a far more serious thing. So if this happens in an infant, and it does happen, I have a 7.5-month-old daughter, and I face this sometimes. Please be aware that this is something that is important. You obviously need to calm the baby down. There's no doubt about it. But the general tendency is that the mother tries to either feed the baby herself or put a bottle in the baby's mouth. Please don't do that. So calm the baby down. Don't try to feed them, because if you try to feed them, there's a chance that the food might, or the milk might, go down the air pipe. So for babies, I think please remember that calming down does not mean feeding, either bottle or breastfeeding. But it does mean just trying to calm the baby down without feeding, tapping on the chest or the shoulder. Okay, cool.
So Dasha is asking, would you do cold and cough if one has difficulty in breathing? What is the best way to manage it?
Disha, I think this again is difficult to generalize on. What is the cause of that difficulty? I think needs to be evaluated. Do you have an underlying tendency for asthma? Do you have some degree of COPD? All of us who are here in Delhi NCR smoke 11 cigarettes a day. So Bangalore people and Mumbai, woohoo. But yeah, Disha, if you have consistent phlegm, cough, and cold in the winter months, it generally could be an early signs of either asthma or seasonal allergies or pollen allergies. I would definitely recommend speaking to a pulmonologist, a chest physician about this, and they'll help you get to the bottom of this, especially if you're having it repeatedly. If you have fever, on the other hand, repeatedly, especially in changing seasons, or you have more than 4 or 5 or 10 episodes of upper respiratory tract infection every year, definitely get somebody to look at the nostrils to evaluate why that's actually happening. So yeah, I think this is a contextual question, might not be able to answer this in a generic fashion.
Okay. I think we are at the end of the session. Thank you so much, Dr. Karan, for doing the session and also patiently answering all the questions. We'd love to have you more often as well. And thank you everyone else for joining. I hope you have a great weekend and great week ahead. Thank you, everyone.
Thanks, everyone. Take care.